everyone. I'm Dr. Krista Burris.
And I'm Dr. Michael Kim.
And we're here with Coachella Valley Direct Primary Care. And today is July 8th, 2021. And we're here to talk about the state of coronavirus in the Coachella Valley. So it is really hot out there, and supposedly this week is going to get even hotter as we get towards the end of the week.
Right. Yeah, it's supposed to get into probably the upper
teens, yeah. So everyone who's out there, be safe, be wise, get hydrated, and hold on. Maybe make a prophylactic trip to the grocery store and stock up on your staples so you don't have to run out. I know for me, my shopping actually changes when it gets this hot. I actually don't want to cook, so we go with a lot simpler meals.
Or we grill.
Yeah, so he has to cook outside. So.
I do want to say for the records, if you can see, Dr. Burris in her right eye does have a little redness. It's not because anyone smacked her, but it is better today.
My defenses are really good. No. Okay.
You should see the other person. Anyway, in case you're wondering out there, it's a benign.
It's a little blood vessel pops. Yeah. So anyway, I thought we'd talk about the Delta variant. As of like a few minutes ago, Riverside County had not updated their data on their website for this week. I know they have it. They just hadn't put it in a place where I could share it with you publicly. Even though we don't have the numbers, I can tell you that anecdotally, we're starting to see a lot more positive tests coming back, a lot more people coming in for testing, a lot more symptomatic people than we were a few weeks ago. And so I think we can anticipate that when we do get those numbers for the Valley, we're going to see a bump in our cases. Remembering that our hospitalizations and then death that occur from COVID happen several weeks after the cases start to go up. So our hospitalization numbers should be stable still, but we need to keep an eye on those, because if our numbers continue to rise, we'll likely see those follow in a few weeks.
Yeah, I don't think it's going to be the same levels as we did before, because
I hope not.
At least from the last chart you showed how well the Valley's doing with their vaccination rates.
Yes, and our most vulnerable population, which is our extreme elderly, so I would say people over 80, that group of people has been very well protected by vaccination. However, it really doesn't take much for them to be put into the hospital. So even though they're protected by vaccination, if they got COVID, they may still end up hospitalized, which in general, we like to keep people out of the hospital, because being in the hospital can cause other problems for people, especially at that age. So other infections, just being in bed that long, can really cause problems. So the other problem with this Delta variant is that we're seeing much younger people require hospitalization, so much higher numbers of people in their 30s and 40s being hospitalized with Delta than with the previous variants. So I think even though we protected our people who are most at risk, we may need to alter a bit our thoughts about who is at risk for severe disease, and maybe lower that a bit and really focus on getting our younger people vaccinated, especially our younger adults, especially when we don't have any way to vaccinate children at this point under 12. So these are the parents of those kids mostly. So it'd be nice to protect them, right, and protect our community by protecting that middle group.
Right. I think one part of the problem is our community is we're a pass through and a destination, and so I think in and of itself, Coachella doesn't probably, at least currently, have a lot of the coronavirus per se as a whole. But as we travel out and back, or people travel through, or people stop from other places, just like the flu, they're just bringing it in here, and it's just going to get more and more.
Riverside County announced today that they have identified 7 cases of Delta variant in the county. This is here. Right now, what they've found in the United States in general is that over 50% of the viral strains being identified are Delta. So basically, that's what we said, every 2 weeks that percentage would double. We're now at 50%, so it's the dominant strain. It probably won't ever be 100%, but what we're seeing now is Delta. And I'm seeing people who've been fully vaccinated come in with symptomatic disease. And the study that came out of England showed that people who had had 2 shots of Pfizer had about 67% protection against getting symptomatic COVID with the Delta strain. So that's down. When we first got the vaccine numbers, it was down from about 88% protection down to about 67% with Delta. So that means you're about 2/3 protected, and you still have that 1/3 chance of catching COVID. You're very well protected still against severe disease, against hospitalization, against death, but you can still catch COVID, still risk long-term complications, and risk transmitting it to other people. So because of that, even though it's not mandated, I've really kind of recommitted to wearing my mask indoors around other people. Even though technically I'm vaccinated, I don't have to. There's no mandate. But just because I'm interacting with COVID positive patients almost on a daily basis, I would rather, protect potentially myself and those around me from getting it.
Yeah, no, agree. So what are your thoughts on what people can do? Right, the Delta is more, you catch it easier, it makes you sicker faster if you're not vaccinated. And we know it's probably here. We'll just say it's here.
No, it's here.
So what can people do?
So, without scaring people, because honestly, I don't think we're going back to where we were last winter. That's not happening. But I do think the mentality of it's over, everything's back to normal is also incorrect. So we're still in that in-between phase where a lot of our activities should be resuming, but we may not be loosening every protection that we have. I don't think that'd be wise, either as a community or as an individual. So for me, I'm like, yeah, I know that there's no law that says I have to wear a mask into the store, but I'm still going to wear one because I'd like a little extra protection in a higher risk environment. And I'm probably going to do that all winter unless we magically get it to go away, which I'm not optimistic, but
right.
Yeah, but I suspect that's kind of where we're going to end up for maybe the next, at least for me personally, maybe for the next 6 months.
Right, because the recommendation is still there, right? If you're not vaccinated and you either get a close exposure or you're positive, you got 10 days, right?
Yeah. If you're not vaccinated, you have to quarantine if you're exposed to somebody who's got COVID.
Or you yourself are positive.
Yeah.
And so that's 10 days of not working, 10 days of, if it's a child of yours now, you can't work. So there's a lot of domino effects still, and then it means if you work for a business, what does it mean for them in terms of their employees? And so, we just don't want to go through that rigmarole.
Right. So I still feel like avoiding this is good. And we can go back to that sort of Swiss cheese model that we used last year of the different layers that we put in to help protect and prevent transmission. So one layer might be social distancing, standing 6 feet apart. Another layer might be hand washing. Another layer might be a HEPA filter in the room. Another layer might be moving something outside. Another layer is masks. Another layer is hand sanitizer. And so all those things together add up to protection. And I don't feel like what's happening with the Delta variant is, and the fact that our vaccines are not quite as good against it, puts us in a position to start giving up all our slices of cheese. Like, I'd like to keep the slices a little more robust until we can get past this transitional period where we still have this huge chunk of our population that's not vaccinated.
I mean, I'm a fan of the vaccine because it's like wearing permanent deodorant. You never have to ever have to worry about smelling bad because it's permanently there working 24/7.
That's awesome.
Don't you wish some, kids could another topic. I know there's also a Lambda variant that's of interest. It's not anywhere on the radar screen of being, at the Delta level, but they're starting to look at it because they're a little worried about it. It's out of Peru, so.
Yeah, there's always new variants being identified, and they go through that process where they become a variant of interest, and they study it a bit, and then if it looks like it's more transmissible or more severe or escapes vaccine, then it becomes a variant of concern. So right now, the Lambda and Delta Plus are variants of interest.
But they got names.
They got named, which is a little concerning. Delta Plus is the Delta variant plus one other mutation that makes it bind to the cells in the body more tightly. So that is like a little concerning because that could increase the severity of disease.
Right. So, we understand there's a lot of difficulty in decision making because we have the same problems, right? We're going to be going to Disneyland ourselves, and 4 of us are vaccinated, and our 10-year-old is not. And so, what does that mean, and how does that mean for what does the group get to do? And these are difficult decisions, and they're going to be different for every family, every person.
Right. And in our situation, we're probably going to avoid certain events that we might not otherwise because we have one of us who's not vaccinated. And also, we're going on this trip. We're going from there to a family reunion where we're going to be around a lot of other people, a lot of older people, all of whom are vaccinated. But still, I don't want to be the family that brings this to the reunion, So
let's not talk about the time we brought the diarrhea to the.
Yeah.
Anyway.
So we've already brought a communicable disease to a family reunion, and it's not good to be the ones who get blamed for everyone getting sick. Let me just say that. Okay. Anything else? We talked about Lambda, we talked about Delta, we talked about how people need to kind of, reassess what they're doing to protect themselves and kind of recommit to something that makes sense for you in your situation. So
yeah, I think we'll probably have a little bit of ways to go. I think as the vaccine gets approved for more younger ages, that'll help. But I do think there are plenty of opportunities still, don't you think, to get current 12 years and up vaccinated? That'll continue to help.
Yeah, and we are seeing a real shift in strategy to try to get vaccine to people rather than expecting people to come to the vaccine. And I think that'll really help, especially to reach some people in places where it's been a bit difficult.
Right. So keep celebrating that we're, not completely locked down, but, there is a Delta variant out there. So be careful, especially if you're not vaccinated. You can get it, and it is easier to get. So,
Yeah, and if you're not vaccinated, please listen to the recommendation to wear masks, especially indoors around other people. And if you're able to get vaccinated, it's not too late. Go ahead and go. It is going to be helpful, even though it's not as protective against the Delta variant. It's very protective against severe disease and death.
So if you can join us in the next few minutes, we will talk about your personal health. And thank you for joining us, and have a great day.